Hey guys, we've got another heart today. This is number 515 in our collection. The heart would have sat in the chest like this. This would have been superior head, inferior legs, left here, right here, anterior coming out towards the screen, posterior towards the turntable. We'll start off as we always do by finding what appears to be the morphologically right atrial appendage, at least externally. And here we find an atrial appendage that's broad-based, triangular, or pyramidal in shape. So we'll go ahead and open up the heart there. And when we go ahead and do that, we do find that there are pectinate muscles that spill outside the confines of the appendage, consistent with a morphologic right atrium. Then we do find the oval fossa here, and the oval fossa here appears intact. There isn't an intraatrial communication within the oval fossa. And then we go ahead and we find the mouth of the coronary sinus, which is right here. And then remember, the mouth of the coronary sinus is going to be an important structure because it also is part of the triangle of Koch. And the triangle of Koch is going to be delineated by the mouth of the coronary sinus, the tendon of Todaro, and then the hinge point of the tricuspid valve. So once again, the mouth of the coronary sinus, the tendon of Todaro, and the hinge point of the tricuspid valve are going to form the triangle of Koch. And at the apex of this triangle, which will be roughly here in this heart, is where we would expect the atrioventricular node to sit. If we take a look at this right atrioventricular junction, we do find a 3-leaflet atrioventricular valve that does have connections to the ventricular septum, consistent with a morphologic tricuspid valve. We would then expect this to be a morphologic right ventricle, and it appears to be, with coarse trabeculations, as well as a septomarginal trabeculation here. And we do see that there is an intact ventricular septum. We go up towards the right ventricular outflow tract, and we find a 3-leaflet semilunar valve here. 1, 2, 3, and there are 3 distinct sinuses as well. There are no coronary arteries that arise from the sinuses of this valve, consistent with a pulmonary valve. And remember, the pulmonary valve, as we can see here, is completely supported by muscle. And another point to remember with the semilunar valves is that, in fact, there is no true annulus. Its true oval or circular annulus is kind of a construct that we've developed for imaging purposes. But in fact, the true annulus of the semilunar valve is kind of this crown-shaped structure here, as the valve leaflets themselves are fibrous and then have these triangles of muscle interposed between the leaflets. Here we find a pulmonary trunk that appears dilated. It appears to give rise to the pulmonary arteries. Right? And we do see that there in fact appears to be a large arterial duct here as well. Now when we go to the back of the heart, we find a smooth-walled atrium here, with pectinate muscles all confined within the confines of the atrial appendage on this side, consistent with a morphologic left atrium. This atrium already appears much smaller than its right-sided counterpart. And here is the mouth of the left atrial appendage, and here is the appendage itself, and all of the pectinate muscles are confined within the appendage itself. Now, when we take a look at the left atrioventricular junction here, we do see that there is a small valve here. It appears to have 2 leaflets, 1, 2, but in fact it is quite small. It does not appear to have any septal connections to the ventricular septum here, consistent with a mitral valve. And then when we take a look at the ventricle itself, it's a very small ventricular cavity. It does have some fine crisscross trabeculations consistent with the morphologic left ventricle. And then we can find the left ventricular outflow tract here, which appears significantly smaller than the pulmonary trunk. You can see an aortic valve here, although not well-defined valve leaflets. And here, in fact, is the ascending aorta. Okay, so we've got a large pulmonary trunk, an intact ventricular septum, a small left atrium, mitral stenosis, a small left ventricle, and a hypoplastic ascending aorta, all consistent with hypoplastic left heart syndrome. Here is, in fact, the ascending aorta here. And then here we find the transverse arch. And then here is the pulmonary trunk. So if we were to look at this from the anterior aspect here, here is the hypoplastic ascending aorta. Here is the transverse arch. Here are the head and neck vessels. Here is the pulmonary trunk. And here is the arterial duct. All right. And then the descending aorta here. So a good example of hypoplastic left heart syndrome. Here's the right ventricle, intact septum. Here's the pulmonary valve and the pulmonary trunk. Branch pulmonary arteries coming here and here. Small left atrium, mitral stenosis, small left ventricle, and aortic stenosis with a hypoplastic ascending aorta.